The first case of coronavirus was reported in Wuhan, Hubei province in China at the beginning of December 2019. The virus, which is now spread to almost all countries in the world, has brought a lot of devastation in its wake. A huge percentage of the number of deaths globally have been reported to be that of elderly persons. In France, Italy, Spain, and the US, which stood out as epicenters, elderly care centers have been affected by a great percentage. The first case of coronavirus in Kenya was reported on March 13, a day that has undoubtedly been marked in the minds of many who watched on their television and listened on their radios keenly the address by the Health Cabinet Secretary Mutahi Kagwe.
Fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
In his address, the CS reminded Kenyans that the disease may exhibit mild symptoms on a healthy person, but the impact was severe for the elderly and with those with underlying condition. Soon after the pronouncement by the Health Cabinet Secretary, the President addressed the nation, giving Kenyans a sense of direction in the wake of this deadly virus, which included the closing of learning institutions, a ban on meetings of any kind, encouragement to maintain proper hand and respiratory hygiene, plus a list of other measures. With the first reopening that allowed for inter-county movement of people, the CS Mutahi Kagwe for a number of times has called on the young to protect their elderly parents in rural homes by not visiting, as it is difficult to know whether one has the virus unless tested, since over 80% of cases reported are asymptomatic. I therefore decided to focus on the elderly persons in our society to get a feel of how they have been coping and what are the challenges they have been facing during this time. Visiting them at their homes for the elderly has been disallowed given the prevailing circumstances. However, by sheer good luck, the management of one elderly home center warmly allowed us to visit them. The home is located in the quiet and serene area of Wangige in Kiambu County. The home hosts about 10 residents. Just from the surrounding, one can tell how peaceful it is for the elderly. The pronouncement on March 13 was taken very differently from Kenyans. I inquired from SJ Remedial Home founder and director James Kinothia to find out his reaction when the first case was announced and what measures he took to safeguard the elderly home.
We did follow the basic guidelines from the Ministry of Labour, Kenya, and Social Protection. Also, we have international guidelines from WHO and other basic guidelines which we initiated within the facility, because it's a mutual link between the families and us, and we are one big family, so we wish everyone good. So we agreed that we limit the visits.
According to the resident nurse Kezia Wanjiko, the elderly have had a difficult time adapting to the new situation.
Now the activities that the Ministry of Health have put up for us to follow, emotionally it has affected the elderly, because now everyone keeps saying, you know, the elderly are more at risk. So emotionally they are not well, so we have had to engage them more emotionally, talk to them, try and engage them in those protective measures so as to let them know actually we are doing something for them. And also the way we were doing things, like we would go out, things like that, you see the way they see things changing, they get more anxious.
Corona has disrupted the social lives of everyone. With the restriction of movement and restriction of visits, elderly persons' social lives have undoubtedly been affected. SJ Remedial Homes Director says pre-COVID-19, Sundays were occasioned by visits from family, and throughout the week they had a myriad of activities that allowed outsiders to come visit them. But now that has been curtailed and they can only do it
because we used to have grooming day. We used to have salon, people coming in, do haircuts, do hairdo for the ladies. And now we had to stop them. We also used to have chaplaincy, people who used to come and every Thursday, they used to come and give us spiritual food. Now for them, they had also to be stopped. We have exercises and youths who come and corporates who used to come for their CSRs, generally once in a while. These days, we don't expect them to come to. So you see, the days have changed.
The nurse adds her voice, saying the elderly are yet to adapt to having less workers in the compound or having no visitors, adding that takes an emotional toll on them.
Some of them are not for that idea, but we have to enforce it, because now you don't know, and you can't keep telling people to come with a COVID certificate. So it's hard for them. They keep on asking, where is so and so, or even the workers who are not able to come in now, because for you to work here now, you have to be stationed here.
There has been significant studies on the importance of a social life for humans, and more especially for the old. Some of the benefits of social life for the elderly include: it is key in helping to combat depression among the elderly. Having a social life helps the elderly keep a sharp mind. Older persons with an active life develop health limitations at a slower rate. The aspect of getting up and ready and stepping out of the house helps in physical fitness for the elderly. Lastly, being around people whose company you enjoy helps lower stress.
You see this loneliness and grief, because most of them, as you have said, they are left behind because maybe their partners have died. So they are still in grief. So when they come here, at least when they are together with people, they do exercises, their day ends quickly, and still they have a social life.
Although it has been difficult for the general public to understand the gravity of the situation and the importance of obeying the stringent measures put by the Ministry of Health, the nurse says practices like washing of hands have been part and parcel of the home way before COVID-19, as they mostly deal with persons with underlying conditions and therefore need to maintain high levels of hygiene at all times to avoid any forms of infection.
From your tips inwards. Yeah.
Other than elderly homes that host their elderly, there are other foundations where they have the elderly meet every so often. I got a chance to have a Zoom meeting with the founder of Compassionate Hearts, Ruth Wanza. The foundation has about 70,000 elderly people's membership across the country. She has a similar response regarding her take on elderly persons and coronavirus and how she broke the news to her members.
So for me, the first instinct was, can this government stop people going to the old people? And also, we actually sent our coordinators to tell our old people to stay at home, because I had seen these people die. But to be honest, I was actually horrified, because I knew from what I had seen actually I was watching the news on Al Jazeera and this international. So I knew that Compassionate Hearts, we had a problem.
Due to the nature of the foundation not hosting its members, they obviously have different dynamics of operation.
So before COVID-19, their lives were very active and they could visit and they could go and see so and so. But now it's actually confusing for them. I have to answer so many questions. How long is this going to go on? When are we going to resume meeting? And now I cannot just tell. 71,000 people are quite many. If I were to tell them, you meet, I will be spreading COVID. So I have to keep telling them, yeah. That's why we have come up now with this small group meeting, that they can now begin to just go meet, 10 of them, and mainly where we have our groups, you realize that the chief is involved or the sub chief. So that is actually monitored and followed.
According to World Health Organization statistics, over 66% of persons over the age of 70 have at least one underlying condition, thus making them vulnerable. Diabetes, hypertension, arthritis, cardiac diseases and dementia, among others, remain the major underlying conditions that affect the elderly.
The most common, say, diabetes, which comes along with hypertension. Let's just say diabetes is a bit common, and it's not. It creates a lot of other issues. You see, when you are diabetic, you don't control it. It brings hypertension. Then hypertension brings cardiovascular diseases. You see, so diabetes is quite a lot.
To clarify on the matter, we sought to speak to endocrinologist Dr. Ivan Jenga to clarify the air regarding diabetes and its susceptibility for the elderly to contract diabetes. There are misconceptions going around that diabetic patients are prone to contract the virus, something that the doctor sternly corrects, saying that diabetes does not make one prone to contract the virus and that anyone is prone provided they don't adhere strictly to the Ministry of Health guidelines.
HIV that sometimes can damage the pancreas, but because the virus is also hits the pancreas. So it has a possibility. It's not that it is thriving. Maybe the pancreas has actually been compromised by this virus. We are waiting for that research. I cannot tell you definitely now that is the virus is doing better in diabetics. I don't think that would be a true statement from me at this point in time without research backing. Yeah.
There is an outpouring call by the Ministry of Health, health personnel and persons taking care of the elderly that it is our responsibility to take care of the elderly as they are prone to contracting COVID-19. We can do this by doing three major things. One, maintaining proper hand and respiratory hygiene, putting on our masks and avoiding unnecessary visits to the elderly.
My message to all those people you have just mentioned there, the elderly, the people with comorbidities, people who are taking care of them, is that we all observe the guidelines. Take care of ourselves as individuals first. If I'm a caregiver, I must also make sure that I do not spread that virus to the people I'm coming across. You heard when the lockdown was being opened, and the CS kept on saying, you young people, you are the first people who are going to run to see your parents up country. Please be kind, just be informed. Do not take the virus to them. You may be carrying the virus, and we know there are symptomatic people over 80%. Even you and me, we don't.
Remember, by taking care of ourselves, we are protecting the vulnerable in this society. Grace Wangoi, Hope TV.